Hello, I'm Rathi Ravindrarajah. I'm part of the Department of Primary Care at the University of Manchester, and today I'll be presenting our results on evaluating the effectiveness of the NHS Diabetes Prevention Program. So the NHS Diabetes Prevention Program identifies those at high risk of type 2 diabetes. So this is also known as non-diabetic hyperglycemia or NDH when individuals have high glucose blood glucose levels, but they're not high enough to be categorized as type 2 diabetic. So these individuals are identified and referred on to a behavior change program, which was done by independent providers over a period of 9 months, which included 13 sessions, which included 16 hours of program delivery, which was mostly done face-to-face, and now it has moved on to a digital phase. So the program focused on diet, increasing activity, and promoting weight loss in these individuals, and it was rolled out across whole of England. So the diploma program was a mixed method research program funded by NIHR to University of Manchester to evaluate the NHS Diabetes Prevention Program. So we have about 8 work packages looking at different aspects of the program: access and equality, such as implementation of the DPP, the outcomes, and cost effectiveness. So our work package is interested in the effectiveness of the program for people referred to the program at a population level. The outcome was conversion rates from NDH to type 2 diabetes from referral, and study design we used was patient level analysis post DPP, and comparing people recorded as referred in practices which were referring to the people not referred to the practice program in practices which were not referring to the program. So the data we used was from electronic health records, using the data from Clinical Practice Research Datalink, which has full practice records from GP practices. We used data from CPRD Aurum as well as CPRD Gold. So CP Aurum collects data from GP primary care practices using EMI software, and Gold collects data from practices using Vision software. So the analysis period was from 1st of April 2016 to 31st March 2020. So by April 2020, we had about around 700,000 people with a read code for NDH, and about 100,000 people with the referral code in the electronic health record. So they had a code referring which said that they were referred to the NHS DPP program. So the primary outcome was conversion of type 2 diabetes within 24 months from referral. So to select our samples, we matched patients on age, sex, GP practice, and date of NDH diagnosis. We also matched practices making referrals to practices with no referrals. So we had to have certain exclusion criteria. We included practices from whole of UK. We excluded practices with 1 to 20 referrals over the whole study period. We excluded practices with no data after 1st of April 2018, and we further matched them on propensity scores based on follow-up time and size of NDH registers. So our results show that when we matched practices and patients and created a cohort for comparison, to best account for differences between these two groups, we focused on the 12,887 cases and one randomly allocated control, which gave us a total population of 25,774 individuals. Within these groups, we analyzed the proportion of individuals who received a diagnosis of type 2 diabetes during the study period. We found that 873 people who were said as referred to the program went on to develop type 2 diabetes during the study period, and 877 individuals who were not referred to the program went on to develop type 2 diabetes. And when we looked at their characteristics over the study period, individuals who were referred to the program were more likely to be obese, had more comorbidities, So when we looked at following the survival analysis, following adjustment for a wide range of patient characteristics, the hazard ratio for cases was lower compared to controls with a hazard ratio of 0.86, and the other significant predictors of conversion were those who were obese with higher BMI were more likely to convert to type 2 diabetes, and if they had a shorter time between referral and NDH diagnosis, those individuals were also more likely to convert to type 2 diabetes. Thank you for listening, and any questions, please feel free to email us. Thank you.